Joining us now is Dr. Laurie Gregg. Thank you for joining us. Can you talk a little bit about physician burnout and how it has certainly changed with the COVID-19 pandemic?
Sure, we know that physician burnout is a very important issue. It's been reported that up to 50% of physicians have one of the three symptoms of burnout at any one time. The COVID pandemic hasn't done much to help this. In our hospital setting, our self-reported burnout rate is about 25 to 30%. And this year with the COVID pandemic, that's increased by 5 to 10 percentage points. And that's despite a lot of hard work around the issue. The clinicians and physicians that are in the hospital setting seem to be impacted much more significantly than those in the outpatient setting.
Can you talk a little bit about why ACOG thought it was important to have a subcommittee on physician wellness within the Committee on Patient Safety and Quality Improvement?
We know that physician wellness and the quality of care and safety that a physician renders are linked. There are studies showing that physicians and trainees who report burnout have higher medical errors. We know that physicians who are burned out have patient satisfaction scores that are lower. And we see studies that demonstrate that physicians who are burned out are actually less effective within a medical team. We also know that burnout may lead to depression and departure from the medical field. So it's easy to see why committees that involve patient safety, quality of care, and access to care can actually be linked and intertwined with physician wellness committees. In California, I always like to remind those that our physician wellness committee birthed our patient safety committee.
And finally, what recommendations do you have for physicians?
So really, I'd like physicians to remember the 80-20 rule when it comes to physician wellness. That if a physician is burned out, 80% of that is because of the medical system they work within and the inefficiency, inadequacies, and burdens that system carries. 20% of burnout is really under a physician's control, really their attention to self-care. So that being said, if we had the most bang for our buck, we would fix the system, but those system issues are large and complex. And certainly we're all happy to know that there are those that are working on those system issues. Stated another way, burnout isn't a physician's fault, but we can impact 20% of that burnout by paying attention to self-care. We know that studies show that we can increase our resilience and wellness by finding gratitude in the things that we do every day in medicine, regulating our balance between work and our outside life, or integrating that work-life balance, regular exercise, and then again, practicing gratitude, positive reframing, and mindfulness. So in that light, I'd like to express my gratitude to all of those working in the medical field to care for patients during this challenging time.
Dr. Gregg, thank you so much for joining us.